Clinical review. Clinical review is the one of integral components of medication review and should preferably performed on the daily basis. Clinical review is performed on the daily basis of the patient. It is the review of patient's progress, the purpose of assessing therapeutic outcome. The therapeutic goal of the patient should be identified before the review. The primary aims of the clinical review are assessing the response to drug treatment, evaluation the safety of treatment, and evaluation the progress of disease, to evaluate the need of monitoring, to evaluate the convenience of therapy, to improve the compliance. These are the goals of the clinical review. Ward round participation. A ward round is a visit that made by a medical practitioner uh, who is alone or with the team of health professionals and medical students to the hospital inpatients at their besides to review and follow up the progress in their health checkups. Usually, at least one ward round conducted every day to review the progress of each inpatient. Though more than is not uncommon. In certain practice settings, such as psychiatry, and a ward round may be conducted away from the patient's bedside in a non traditional fashion, because to know the drug efficacy and any is there any side effects of the patient, it should be noted by the ward counseling. The goals of ward round participation. Here, the health practitioner can closely monitor the patient's condition and take the intermediate intervention to improve the patient's condition. The doctors are visiting all the patients who admitted in their unit in order beginning from the intensive care unit. Here also documented case reports to remind the case history of patients who quickly update the change of strategy of the statement. The ward team comprises of doctors, nurses, pharmacists who work in a team with the common objectives to increase the safe, effective, economic, patient-friendly treatment with the knowledge which inputs the professional practice. In this ward round participation, the role of pharmacist is to begin the expert in the matters of drug which should be available for the ward round, to decide the dosage regimens and formulary interpretations, adverse drug reactions, drug interactions, drug food interactions. It can be explained by the pharmacist. The availability of pharmaceutical service defines to increase the accuracy of the treatment. The duty of pharmacist in ward rounds is to check the to take two times, one with the doctor and another one with the himself alone. The first ward round he follows the treatment given by the doctor, and further he also may be critically think any possible risk to the patient due to drug administered. He will alert the team and prevent the casualty that would have occurred due to the non-availability of the clinical pharmacy service. In the second round, the pharmacist target patients prior to the discharge. So he advised the patients which record the discharge medication practice in the rounds. He also motivates the knowledge, diet, exercise which required for the disease management for the patient to the discharge. According to this, the importance of ward round participation, the withdraw the withdrawal of pharmacist from the ward round will be great loss of the clinical team and patients. The medication error, incorrect dosage can be bring down the therapeutic outcomes. Another subtopic is pharmaceutical care and pharmacist intervention. The pharmaceutical care is defined as the reasonable provision of drug therapy for the purpose of achieving definite therapeutic outcomes to improve the patient's quality of life. Goal of pharmaceutical care to optimize the patient's health care which related to the quality of life and achieve the positive clinical outcomes within the realistic economic expenditures. Some basic elements which are in the pharmaceutical care, they are patient oriented, acute chronic problems, stress prevention of the drugs, and documented systems, continuous symmetric way, and taking help of the other healthcare provisions to increase the patient health quality, to identify the potential and actual drug related problems, to collect the patient data and to identify the problems. By the establishment of the goals, the good therapeutic plan will be achieved by the pharmacist. Types of pharmaceutical care. The pharmaceutical care is four types, that is SOAP analysis, core pharmacotherapy plan, pharm analysis, and prime plan. These are the four types of analysis which included in the pharmaceutical care. In SOAP analysis, the SOAP format is the one of the mostly used medical practitioners. However, it is used within the pharmaceutical care context. In this context, the section must be revised to match the pharmacist legal scope of the practice. Here, S is abbreviated as subjective findings and O is abbreviated as objective findings. A is assessment, B means plan. The SOAP analysis full form is subjective finding, objective assessment, plan analysis. And second analysis is core analysis. Here, condition of the patient and outcome desired condition, remaining selected outcome and evaluation parameters can be analyzed in this core pharmacotherapy plan. After that, pharm analysis. In this pharm analysis, finding assessments and resolution of the monitoring, it includes some prevention also. It can be analyzed by the pharm analysis to finding the preventions like any health hazards can be founded by this pharm analysis to without holding the medication, advising against the use. This is the main theme of the pharm analysis. In this pharm analysis, the pharm note or SOAP note can be desirable. Fourth analysis is prime pharmacotherapy plan. Here it includes the pharmacist intervention. The goal of this prime pharmacotherapy is to identify the actual and chronic problems of the patient. This prime pharmacotherapy, which is abbreviated as pharmaceutical based problems, risk interactions with the medication efficacy. Thank you so much.